All right, we'll go ahead and get started with today's subcommittee meeting. This is the Tuesday, June 22nd meeting of the COVID-19 Response Subcommittee. I'm City Councilor Jesse Letterman, Chairman of the committee. We're joined here by Councilor Curran and Councilor Hurst, as well as the Commissioner of Health and Human Services, Commissioner Helen Colton-Harris. We do have the recording going, so this will be uploaded to the Focus Springfield YouTube page in accordance with the current allowable options for remote participation under the open meeting law. And I know we also have some members of the press with us today. So thank you all for joining. I think what we'll do is turn things over to the commissioner for an update. It's been about 2 weeks since our last meeting. So, I know councilors would like to hear how things are looking from the health department's viewpoint, and then we can open it up to any questions that councilors may have for the commissioner and discuss our next meetings. Commissioner Colton-Harris, the floor is yours.
Thank you. And thank you for this opportunity to update the council and the COVID-19 subcommittee. Thank you, Councilor Letterman. So what I'm going to briefly do is go over the data from this week, and then I'm going to go over some vaccination data. Again, the data is uploaded onto the city's website, so the charts are there every week. So please feel free to take a look as you will. So I'm going to start with the confirmed cases in the city of Springfield, and I'm going to go over about 3 or 4 of the charts. And so as we look at last week, and this is June 13th to June 19th, Sunday there were 0 cases, Monday 6, Tuesday 3, Wednesday 6, Thursday 6, Friday 3, and Saturday 3. And so our cases last week were absolutely within range of continuing to go down. The confirmed cases by age group, 0 to 10 was 3, 11 to 20, 3, 21 to 37, 31 to 42, 41 to 54, 51 to 65, 61 to 72, 71 to 80, 0, 81 to 90, 0, and 91 to 101. The zip code cases, 01101 had 0 cases, 03, 0 cases, 046, 053, 070, 082, 097, 182, 193, 280, 292, and 512. As I said, the cases over the last 6 weeks have gone down. The week of May 9th, there were 154 cases that week. The week of May 16th, there were 156 cases. The week of May 23rd, 118. The week of May 30th, 65. The week of June 6th was 30. And the week of June 13th, where we are now, is 27. So we decreased our cases last week by 3 cases. Right now, for the month of June, we are at 115 confirmed cases. May had 788. Again, we continue a downward trend as far as the month is concerned. 30 and under group continues to be, even with the low case rate, continues to be the group that has the most cases. 30 and under, 48%, 31 to 50, 22%, and 51 and older, 30%. So that is a quick overview of the data from last week. I'm happy to answer any questions about that, or I can continue and just go over a little bit of the vaccination rates.
I think I'd like to hear about the vaccination rates, Commissioner, and then we can do questions on both.
Okay. So the vaccination rates in the city right now, 0 to 64. The city is 32.6%. Mass statewide is 52.6%. So we are lagging in that age group by 20%. I should point out that we have asked the Commonwealth to break that out better. 0 to 64 is a huge number as far as cases are concerned. And so we believe in order to be more specific, we need to break that out more. But as it stands now in that age group, we are 20% below the Commonwealth. 65 to 74 is for Springfield, it's 77.6. For the mass statewide, it's 84.5. So the city in that age group is behind the state 6.9%. 75 and older for the city of Springfield is 73.2%, and for the Commonwealth, 81.8%. In that area, we are 8.6% below the Commonwealth. I'm just going to briefly go over race and ethnicity, which I think is important for us to remember. So American Indian, Alaskan Native, fully vaccinated. These are fully vaccinated numbers that I'm giving you. That population in Springfield is 22.6%. For the Commonwealth, it's 33.4%. So we lag in that age group, in that race and ethnicity by 10.8%. Asian, fully vaccinated. In Springfield, it's 43%. For the Commonwealth, it's 57.3%. Again, in that age category, we are behind 14.3%. Black, fully vaccinated in the city of Springfield is 28.3%. For the Commonwealth, it's 40%. In that age, in that race and ethnicity, we are behind 11.7%. Hispanic, fully vaccinated, 23% in the city of Springfield. In the Commonwealth, it's 83%. So it is 15% below the state average. The Native Hawaiians, Pacific Islander, fully vaccinated in Springfield, 64.4%. For the Commonwealth, it's 77.4%. So again, 13% behind in that age category. The white population in the city of Springfield is more closely aligned with the state numbers. And so the white vaccination rate in our city is 51.2%. For the Commonwealth, it is 56.3%. Let me just do that number really quickly. 65 and then 51.2. Yep, so we are 5.3% in the white category below the state, but that is the closest category to the state average that we have. So those are the fully vaccinated numbers, and those are the numbers that I'm going to report to you today. If you'd like to look at other data around the report, I'm happy to send that to you. I think I'm just going to do a couple of updates. I think we had two amazing Juneteenth celebrations that both offered vaccines to our residents. The Ray Jordan Center and certainly the Juneteenth celebration in Court Square both had vaccination clinics. We are every Thursday here at this office, we meet with all of the funded COVID-19 outreach entities that are community-based organizations. BHN, Tapestry, and New North meet here at the department every Thursday at 10 o'clock so that we are coordinated our outreach efforts together, so we're not duplicating each other when we go door to door. We are still doing clinics at Bolin, Ray Jordan, Brightwood, BHN is still doing clinics, and JC Williams is still doing clinics. So our clinics continue to go forth. We're having one this evening. As all of you know, across the Commonwealth and across the nation, the vaccination rates have slowed considerably. We are considering what incentives we can give to our residents in order to, particularly our younger people, in order to get individuals vaccinated. Right now, Springfield Public Schools, we have done about 200 vaccinations, and and we'll continue the effort through the summer with summer school, but that's pretty low. So we're doing 12 and older at this point. and continuing to reach out to our public school students. I'll stop there and answer any questions that you might have.
Thank you, Commissioner. I'll have a few questions, but I want to give the floor over to any of the counselors that are in attendance. I know while you were giving your report, we were also joined by Councilwoman Whitfield. So if there are any questions from the counselors present, if you want to, feel free to raise your hand or unmute yourself and jump in. We'll take them at this time. I see Councilor Curran.
Hi, Commissioner. Hi, Councilman Liederman, Whitfield, and Hurst. I just update. How is the door-to-door vaccination program going? I know we're doing some outreach to the homebound community, and if you could provide some insight to how that's going and the progress we're making this summer on that, Commissioner.
Happy to answer that question. We, Commonwealth Care Alliance at the state level, is doing the door-to-door homebound vaccinations. We are not doing that. They would not, the state did not approve our vendor who was AMR. I shouldn't say they didn't approve it. They're not a part of the Massachusetts immunization system, and you have to be in order to handle vaccines. So we are not doing door-to-door. Our outreach efforts are, we believe, are being successful. We're having conversations with people. The individuals we're reaching out to now are the most resistant and the most hesitant. And so it's not just about saying to them, please get vaccinated. It is a conversation, asking questions. Why are you hesitant? And answering questions. So we feel as though it's going well, but it's time consuming because people really do want education and information, which we are happy to provide.
Thank you, Commissioner. Councilor Curran, did you have any follow-up there, or are you all set?
No, I'm all set.
Okay, thank you, Commissioner. Just on that, do we have any? I mean, I know individuals are able to contact Commonwealth Care Alliance for homebound vaccination, but have we had any information from the state about, what rates, if any, we've seen taking that up in the city?
Yeah, I mean, we've had some feedback, and I certainly can get more, but it appears that that number is also very small in terms of, I believe the last time they talked to me, they had done somewhere around 50 homebound individuals in the city of Springfield, or individuals who could not get to a vaccination site. That was 2 weeks ago. So let me commit to getting updated data around how many vaccinations has Commonwealth Care Alliance done. As you know, we do have Commonwealth Care Alliance in the city of Springfield. Although they are a statewide entity, there is a number of individuals who work with that organization who are based at Neighborhood Health Center in Mason Square and Brightwood Health Center.
All right, thank you, Commissioner. I just put in the chat for counselors, I did put the guide from the state on how to access homebound vaccination. So if you do have constituents who inquire, there's a central intake line that individuals can call. And I believe this has also the criteria for that.
Thank you for doing that, Councilor Letterman.
Absolutely. I think we've also been joined now by Councilor Allen as well. Any other questions from counselors for the Commissioner? Councilor Hurst?
Yeah, I do have a question. Commissioner, thank you so much for being here as always. The Delta variant that has been talked about a lot, coupled with the fact that, I think we're starting to see, more, we're starting to see more cases of our young people having more severe reactions to the Delta variant, or at least that's based off of what I've read. And then I just recently read an article about, in Israel, the rates are starting to skyrocket as a result, maybe not skyrocket, but certainly starting to increase rapidly as a result of the Delta variant. Have we started to think of precautionary measures that we might be taking here in Springfield, considering that the vaccination rates, aren't quite where we would probably like them to be, especially as it relates to our camps, and then knowing that, school will be before us pretty quickly. And, I don't know if there's been a mass mandate by our Department of Ed, but I'd love for you just to talk a little bit more about what your thoughts are on the Delta variant and, kind of steps moving forward for the city of Springfield.
Thank you, Councilor Hurst. That's an excellent question, and I'm glad you asked it. You probably know that the DESE has said for the summer, they're recommending students keep face coverings on, but they are not requiring it. It's going to be my recommendation that we consider making a requirement with Springfield Public Schools. That's a conversation that needs to be had, obviously, with the staff at the school department as well as this department. So the mask mandate for summer has been recommended and not mandated. Also, that in September, the commissioner the Commissioner Riley, I think his name is, has said that you don't have to wear a mask. So they're lifting the mask mandates for September. That is very concerning to me. And I've said that because we do not know. The unknown factor is the Delta variant. The Delta variant is spreading very quickly. You will read about 6 individuals who died, and they believe that it was the Delta variant. The ones that were exposed to what they're calling the zero patient, the ones that were exposed to that individual that were vaccinated, I'm understanding, did not have adverse reactions. 2 people died and 3 were hospitalized, and I believe this is in Florida. So the Delta variant is a real concern. It is 70% more transmissible than any of the other variants that we know about, so or that we've experienced through this pandemic. So the concern is, and I said this as well, is that we don't know what the city is going to look like or this nation is going to look like come fall and come, late summer and early fall. So lifting mask mandates may be premature depending on how this variant behaves because it's already in the United States. And so if this variant takes hold, the individuals who are vaccinated, you are absolutely correct. It appears that are really vaccinated and is not in danger for the Delta variant, that current vaccines work well with that variant. So yeah, we are concerned about it. So what's our recommendation for the city of Springfield? It really is that we need to be vigilant about tracking this variant and how it's behaving in the United States, because that's going to tell us what we need to do as a city and as a nation as we move forward as this variant spreads. I believe that we're going to see other adverse reactions from this variant in the Commonwealth and in probably the city of Springfield.
Thank you.
Thank you, Councilor Hurst. Any other questions from councilors for the commissioner at this time?
I have one quick question, Councilor.
Councilor Whitfield?
Thank you. Commissioner, I don't know if you said the total of vaccinations in Springfield compared to the state. I heard the breakdown, but I didn't hear the total.
Okay, let me just, that is an excellent question. So I can certainly find that for you. Okay, so vaccine administration, the grand total administered in the city of Springfield, 127,829. The number mass statewide is 8,359,570.
Okay, so what's the percentage on the, I'm sorry, I meant the total percentage of vaccines that we've given out in Springfield?
The total percentage, are you talking about the total of individuals fully vaccinated?
Yes.
Percentage?
Yeah. Yes.
That we've given out in Springfield? Okay. So, and I'll go back to the data that I just read so you can hear the numbers.
Well, I heard the breakdown by race and I heard the breakdown by age. I just didn't get the total percentage in in Springfield compared to Mass?
So I'm going to give you that now.
Okay.
So in the 0 to 64, we gave 44,341 immunizations. In the 65 to 74-year-old, it was 9,432. And in the 75 to years count, it was 5,839. So when we add all of that up, that gives us our total Springfield number, which is the grand total administered, I believe.
Okay.
Do we have, Commissioner, when you total that, I mean, we can calculate it, but when you total up all those, do we know what percentage that is of the city?
I do not. I mean, I know we have 153,000. I believe that
Right.
we are basing that vaccination rate on. And so I'm not sure what percentage is that. But yeah, we do know that. We know that that for the city of Springfield, our total percentage is like 38.5% as opposed to Commonwealth, which is around 60.
So that's 38% of the city fully vaccinated total.
That's right. That's absolutely what I have here, Springfield. But when we look at first doses, I'm sorry, I'm plowing through these numbers. When we look at one dose, we are 42.8% as opposed to the state, which is 62.2%. So the one dose number is higher than obviously the total number, and hopefully those individuals will go back for the second dose unless they got J&J, so that 30-something number will continue to rise.
So if 38% of the city is fully vaccinated and 42% of the city has at least one dose,
42.8.
then presuming that those one dose, the individuals who have received one dose, that they return for their second dose, which the data shows is pretty high, that once people receive the first dose, they return, that should significantly boost the total percentage.
Yes.
Okay. Councilor Whitfield, I'm sorry, I didn't mean to interrupt.
No, that's okay. And so my next question is just, I know a few people that got the first dose and didn't go back in the 30 days or 28 days to get the second dose, but said they still considering getting the second dose. Would the first dose time start over, or could they just go and get the second dose?
So it depends on, so what we are saying to individuals, if they, so after that 28-day period, we would, another 14 days to get the second dose, and we believe that that is effective. If they go beyond that, then, you know, we would recommend that they consider getting another first dose. And we also recommend they go to their primary care doctor and have that conversation, because at that point, compromised health could, you know, impact it. So we do it in kind of two ways. We say you should start over, but first check with your primary care physician and make sure that they're on board with your with what the recommendation is.
Makes sense.
Because the clinical trials were 28 days. To go beyond 28 days, I mean, DPH has said we can go beyond about 14 days, but to go beyond that would really be, you know, something that we would not want to take responsibility for. Therefore, that's why we recommend the primary care physician.
Okay, thank you very much, Commissioner.
Thank you, Councilor Whitfield. Councilor Hurst, did you have another question?
Jesse, I have a question when you get to me. I'm driving, so.
Oh, okay, sorry, Councilor.
Let
No
Councilor
problem.
Allen go first.
Councilor
I'm
Allen,
actually in the
Councilor
middle of
Hurst will
picking up my
yield, and then,
kids.
okay, we'll circle back to Councilor Hurst. Councilor Allen, go ahead.
Yeah, thanks. Thanks, Councilor Hurst. Yeah, I know that basically there's a 20% difference between the state numbers and the Springfield numbers. It's different. It varies from that a little bit, but we generally lag about 20%. And Helen, we were doing all that outreach. The state was doing some outreach with, I know, Zaida Luna and other, maybe Desi Jackson and stuff. And you were doing some. Is that outreach continue, and is it working? Or like, are we doing mobile vaccines? I just don't have an update on it. And has anything been found to work at getting people who have resisted to change their minds?
We're doing our best. As I said, I'm not sure if you were on the call then when I said that we are meeting with every Thursday at 10 o'clock with all of the DPH funded entities, BHN, Tapestry, New North. They meet here every Thursday. And every Thursday we develop strategies together to try to figure out how we can meet the needs of the population and try to get individuals go from resistance, hesitancy to acceptance. So is it working? If we continue to see even a few people get vaccinated, then we think it's a success.
Okay. Do we have mobile vaccines going on where we drive a vehicle somewhere and people can come up to it?
Yep, we're doing pop-ups. As you know, there was a pop-up at the Basketball Hall of Fame. Mr. Bolduc from Pride called me, and so he has offered his Pride stations for pop-up clinics, and we will be doing pop-up clinics at the Pride station in Mason Square or on State Street. We'll also be doing one in the North End at that Pride station as well. I've also heard from Big Y. Big Y has said that we could use their parking lot where on St. James Avenue, where there's a Big Y. They tell me that they own that entire plaza, and so we can use as much of that space as we'd like. So, I mean, we continue to work to go to our residents. We know asking people to come to us at this point is really not working in the way we wanted it to or we would like it to. So now we're just setting up pop-up clinics across the city of Springfield.
Okay, so I don't know what I could do or what other counselors can do, but I've got a little more time on my hands at the moment. Plenty to do, but if it helped to have city councilors at some of these things, if that was, I know you don't need help with the operational part of it, but with getting people to come, I don't know if there's anything in there, but I'd be willing to help in that way.
Thank you, Councilor Allen, because I think all city councilors have constituents and really have power around convincing individuals to get vaccinated if they're willing. And so what I would appreciate, if you heard my data, there were no, we had no positive cases in your ward last week. We'd like to keep it that way. So to the degree you can tell your constituents it's important to get vaccinated, that would be very, very helpful.
Okay. Yeah, I'm sorry, I was 15 minutes late on the call, so I missed some of that. But thank you for addressing my question.
No problem.
Thank you.
And thanks to Councilor Hurst for deferring it. Don't forget he was next in line.
So we have a few folks up in the queue. Commissioner, I just wanted to ask related to Councilor Allen's question. We had spoken a few weeks ago about the advertising that the state is doing and also the advertising that the city's doing. Do we have any updates on what that advertising looks like? And I know there had been some talk of doing social media advertising around both the need to get vaccinated and the vaccine locations. Has the city, has the department or the administration pulled the trigger on that yet? And if so, do we have those ads out there?
Yes, our marketing is really very, very strong. As you know, we have the Vax Force, and the Vax Force members are doing media interviews, I guess I'll call them, media interviews using their platforms as well. The city has marketing materials. We go door to door with our marketing materials. We did a television ad. We're in the process of setting up additional, buying additional marketing assets. We work closely with the state. Every week I speak to them about marketing. We have customized our materials and attempting really to use what we have as far as to reach the residents. Again, we're at the point where we're really in a position where we're with people who are really the ones who are really having a difficult time or want to wait and see or just not trusting. I mean, there's many reasons. So we're doing the narratives with people in our door-to-door, and we are going to use the narratives in our next marketing campaign.
Councilor Hurst.
Thank you, Mr. Chair. Couple questions, I guess, Commissioner. One related to the marketing piece. I know that the state did some marketing in Point of View. I think one of the, one of the things that would have been nice was to, at the very least, identify where it is that folks can get vaccinated. And I know there probably wasn't a coordinated effort between the state and the city in terms of what their ads would look like. But, it's one thing to advertise, but it's another thing to highlight where folks can actually get the, get vaccinated, which I did not see. In addition, I was wondering if there's any follow-up from the state in terms of ensuring that those individuals who are going door to door are actually, or from the city, are actually doing what it is that they are being paid to do. And so I'd love to hear if you had any information on that. And then lastly, have we thought about going to our churches? I mean, have we done any coordination with our clergy in terms of setting up maybe some pop-up clinics at various churches at all?
So a couple of things. You asked about the, first of all, the follow-up as far as the marketing is concerned. And I absolutely agree with you. And it's been no secret that I have said to the state, I think they've done a poor job of marketing in the city of Springfield because they have not reached out to those venues that we might frequent. And so they did reach out and do some marketing with WEIB, Flu FM. They did one in the Point of View, I understand, but they need to do more with those because just a one and done is not sufficient. And I agree with you that, and I'm going to actually probably take out an ad from the city with that information where our clinics are, because I think you bring up a very important point, that it's one thing to say, get the vaccine, but it's another thing to say, here's where you can get it. I should say when we go door to door, we do have that information with us. The faith community, there is a faith committee on VaxForce. They've been very active around working with our faith leaders and trying to help encourage as far as vaccinations is concerned. We certainly can do more, and I will bring that to that committee so that they can, but I know that since we've did that vaccination clinic at St. John's, they continue to be in touch with all of those pastors who participated. Have we done clinics, pop-up clinics there? No, I don't think we have. We did the one at St. John's. And we continue to ask pastors to work with their congregations, but that's an excellent idea. We can consider reaching out and seeing if they want to, pastors want to host us. But keep in mind, any church we go to, there are certain physical requirements that we have to have in order to do a vaccination clinic.
Thank you.
Thank you, Councilor Hurst. Councilor Curran, followed by Councilor Whitfield.
Hi, Commissioner. I did see your commercial. It's a great commercial. I think you're in it along with several other city officials. I was just wondering, are we doing the same commercials on Spanish language radio and Spanish language television? I know. I was just wondering if we were doing that.
Yes, as a matter of fact, that was a question that Jose Claudio asked. He's on the VaxForce. And so when I met with the Commonwealth, they have assured me that they have done commercials in Spanish language. They also said they have been to the Spanish language newspapers, and they were going to send to Jose Claudio the places that they advertise, because quite frankly, he said with the state on the phone, I haven't seen them. So if you bought them, if the state did a media buy in his neighborhood, he has not seen them. So the Commonwealth says that they have reached out. So we can follow up, but they have assured us.
Would the city be able to just put one together here? I mean, would we have resources to just put something on Spanish language radio? I believe the station's in West Springfield.
Yeah, I mean, I think again, the city asked that question of the state, and they told us that they had had it covered. As you know, they gave $82,000 to their outreach teams to do marketing and to do any media buys but I certainly can follow up with that. In the Black community, I know the Black COVID committee just got another $75,000 to do the outreach and follow up that's necessary. So that's necessary in the Black community. So the state saw itself, and this did not go through this department, but the state sees itself having voices that they are funding in order to do the marketing, the media buys, and outreach. And I don't think I answered, Councilor Hurst, I don't think I answered your last question. The Commonwealth does send me areas. They don't give me specifics, but they might say, they give me a piece of sheet of paper that says that that Ward 3 is being targeted by the outreach team, or Ward 4 is being targeted. They don't give me specific streets or anything, but it is their way of saying that the teams are really doing the work in the city.
Councilor Whitfield.
Thank you, Counselor. So mine is kind of like feedback and a question. So someone from New North Citizens Council came and outreach to my house, and I was glad to see him, but the person couldn't speak English. So if I had any questions for the person, they wouldn't have been able to answer it. And so I want to know if that type of data is looked at when the outreach committees, or when you all get together and talk about who should approach, you know, which neighborhood. And of course, I have a couple of Latino families on my street, but it's a mixed street. So I'm gonna say we got all cultures and races on the street. So I want to know that. And this is from the North Citizens Council, and I have been getting like a couple of complaints that they traditionally hire just Latino folks to do the work. And I don't know if it's because those are the ones that's coming to the door, but I would like to know the number of what other minority groups they have doing outreach, because just to be honest, people feel more comfortable talking to folks that they're familiar with. And Pioneer Valley Project also got an outreach grant. And so when they are looking for someone to go to the Black community, well, they actually just hired my daughter. And I think that it makes sense to have, you know, someone, you know, Black go to the Black community. It's not that anyone can't go on outreach, but she couldn't answer any questions because she didn't even know English. So I don't know if that's something that you all discuss in the meetings.
Councilor Whitfield, I will bring that back for our Thursday meeting. Thank you very much, because we're very intentional about language and making sure that individuals speak the appropriate language in order to do the outreach. And that should go for English as well. So I will bring that back to the outreach team. Bishop Swan has been funded, and it's my understanding he has an outreach team that should be doing primarily the Mason Square community. Zaida Luna in the North End has an outreach team that is also funded to do outreach, but they are doing it not just in Springfield, but Holyoke as well. And then the Black COVID-19 Coalition has also been funded to do outreach in the neighborhoods or in and around Mason Square. But I will bring what you said back to the Thursday meeting so that we can at least make sure whoever is knocking on doors is equipped to do that.
Thank you, Ressa. That's all.
Thank you, Commissioner. Now, I just had a couple of questions as we head towards the closure of the Eastfield Mall location in July. Do I understand correctly that also the Bay Street site will be closing?
The Bay Street site will probably remain open in some fashion when the Eastfield Mall closes. Curative has been really doing a lot of outreach as far as pop-up clinics are concerned. So right now, they had penetrated that area, so they were getting very few individuals in. But it's my understanding once the mall closes, Curative will be on that site because we know we're going to need the neighborhood sites more than ever once that Eastfield Mall site closes.
And that was going to be my next question was, what do you anticipate changing in terms of the neighborhood sites once Eastfield Mall closes? I know we've been sort of consistently doing Ray Jordan Center, consistently doing Bolin, consistently doing J.C. Williams Center and the Bay Street site. But I'm wondering if there will be some changes considered as the Eastfield Mall closes.
I do not believe our recommendation is going to be to expand fixed sites unless we see the foot traffic significantly increase. What we will expand, as I just talked about, is the pop-up clinics like the ones that we're going to do in the neighborhoods. But we will keep the consistency around this schedule will stay fixed. Just because people know we're there, and hopefully our foot traffic will increase. It has decreased significantly, as you know. BHN also is vaccinating for us. We give them vaccine every week. They have stopped asking for it because of the low numbers that they're getting as well. So we will keep Ray Jordan, Bolin, Brightwood, BHN, all of those sites will stay fixed. And then we'll look to do more pop-up sites, mobile sites in the city.
And what is the state saying in terms of how they envision continuing to support municipalities with the closure of the mass sites? I mean, what's their commitment been around, continuing to supply us with the vaccine and with marketing and that sort of thing?
Those marketing and vaccines are things that they have made a commitment to. So I don't anticipate we'll have any problems getting vaccine. And I do know that the marketing, we do talk to them every week about marketing and strategies around marketing. The other thing, well, the state just put out for municipalities a $300,000 grant, which we will apply for. And that will be, but that is, remember, they're also discontinuing their contact tracing initiative statewide. And so that means that as a municipality, contact tracing will become solely the responsibility of the Board of Health. So we will need additional contact tracers, and we will be putting individuals on staff to do that because the state is ramping down. As a matter of fact, they have shuttered most of the individuals who were doing contact tracing for these states. So two things we'll have to pick up: vaccination as well as contact tracing.
And my last question, Commissioner, is around the need for boosters. Have we received any updated guidance from the medical community or the state around the possibility of boosters being needed for the vaccine? And if so, at what time we would need to start considering that process?
We have not received any recommendations from the state around when boosters are going to be necessary. I don't think that has been released on a national level. I believe that boosters are still in clinical trial at this point. And so there has been no information that I've been giving around boosters and when we should get them at all.
Okay, thank you so much. Councilor Hurst.
Thank you, Mr. Chair. Commissioner, as we start to see the foot traffic dwindle in the vaccination sites, have we put any thought to possibly either closing some of them down and maybe putting more efforts into door-to-door, picking folks up and transporting them to maybe 2 sites as opposed to having 7 sites open and operational, or or something along those lines, to where we're actually getting the people who are interested in getting vaccinated to the locations if they can't get there themselves.
So Councilor Hurst, yes, I think that's something that we do need to consider. I would like to wait to make that recommendation once curative closed down and we see that we don't have the penetration in our sites. Then I think we can consider collapsing a couple of them. As far as transportation is concerned, Uber, the state has a contract with Uber. I'm not sure if our residents know about it. I believe it's on our website. I can check that, but we have individuals can call Uber if they're going to a vaccination site, and they will be taken there. They will be picked up and taken back home. So there is a transportation mechanism in place that residents can use.
It might be nice if on our informational material, when we get to that point, if we had sort of a number where folks could call who are interested in getting a vaccine who can't get there. I mean, Uber is great. Although, I tried to get an Uber a couple weeks ago, and, wait time was pretty significant. And just the other night, they weren't even in my area. So, and then that's also something that young folks probably who are a little bit more tech savvy are able to access and take advantage of. So, I definitely, in any information material that we have, it would be nice to have a number if folks actually want to be transported or need a ride to get a vaccine, and then maybe having us coordinate how to get them there. Just a thought.
No, excellent recommendation, and I will do that. Uber is supposed to be prioritizing individuals who want to go to vaccine clinics because they have a very hefty contract from the state in order to do that. So, but I will definitely, I think that's an excellent idea. I will make sure that the number is provided. And if the Uber information is not on the city's website, I will make sure that it gets there.
Thank you.
Thank you, councilors. Are there any final questions for the commissioner before we end today's meeting?
No, Counselor, but I just did want to give a shout out to Counselor Hurst. He has been committed to going on the radio station a couple times a week to give out the vaccine information. I started with him, but I kind of fell off. So I just wanted to thank him for still, being committed to the residents of the city of Springfield.
Thank you, Councilor Whitfield. All
You,
right,
Counselor.
any further questions for the commissioner before we close today's meeting?
If I may just say thank you to all of you. I think you have been you've asked some very thought-provoking questions, and I think they help me to think and help me to make decisions based on the feedback that I get from you. And so I want to thank you, and I will follow up with all of the information that you've given me. And Councilor Whitfield, do you want me to send you the full vaccination report so you can look at it?
I wouldn't mind it.
You're gonna look at it?
I am gonna look at it.
All right.
I definitely would. I would like it as well, Commissioner. If you could send that along, that'd be great.
Okay, I'll do that.
Thank you, Commissioner, and thank you, councilors. Our next regular meeting of the committee is scheduled for July 6th. So we will see folks then. And as I mentioned at our last meeting, in conversation with the commissioner, we've decided to start holding these updates bi-weekly, but we'll still schedule additional meetings as needed with other departments or on other particular pieces of the pandemic response. So if there is an area of interest, please don't hesitate to reach out to myself or President Williams, and we'll be glad to facilitate that. Seeing no further questions, thank you all for coming. We'll adjourn the meeting and hope everybody has a great rest of their night.
Thank you.
Thank you.